Hello, this is Dr. Dave Yachter, the chiropractor. Thank you for joining me in today's segment of our condition of the week. Today, we're going to be talking about vertigo. And dizziness and vertigo are among the most common symptoms causing patients to visit a doctor every year, just as common as back pain and headaches. So, probably the most common effect from dizziness or loss of balance is falling. And we all know that this can be a big burden, especially on the elderly. Falling, causing fractures, hospitalizations, it can become very problematic. So getting to the cause of this can solve a lot of problems, can prevent a lot of problems when it comes to vertigo and imbalance and dizziness. So that's what we're talking about today. So the overall incidence that occurs as far as dizziness and vertigo can be up to 40% of people of our population when you reach age 40 and over. So it could be a good percentage of the population, and it becomes very, very common the older that you get. So when you're dizzy or you feel lightheaded, woozy, or disoriented, if you feel like this or the room is spinning, obviously this is the point where you get diagnosed with a condition known as vertigo, which is, a case of dizziness. Now, there are different causes. And before we get into that, if you didn't know, the economic burden on this can actually be staggering, as much as $13,000, almost $14,000 per person per year when it comes to doctor's treatments, hospitalizations, and lost working days. One study in the United States that was done showed as much as 69 days lost out of a 12-month working year. That's nearly 20% of an annual working calendar. So, as we look at this and as we study the statistics, it becomes really apparent that this is something that a lot of people suffer with. And it's a problem that begins to compound in many different areas of their lives, not just how they feel, but also financially as well. There's a major impact as this type of condition continues to progress. So what can cause the vertigo or the dizziness? It can have a lot of different causes. A sudden drop in blood pressure can cause dizziness. Being dehydrated can make you feel dizzy. If you get up too quickly from sitting or from laying down. If you have a problem with your inner ear, it can cause dizziness. Sometimes dizziness or balance problems can be a symptom or an effect of medication that's being taken for other health conditions. BPPV, I'm going to say that again, BPPV, which stands for benign paroxysmal positional vertigo, is the most common type of vertigo. And it's characterized by what's described as a brief recurrent episode of vertigo. This type of problem continues to recur. It comes and goes, but it doesn't necessarily resolve itself, and that's where the problem is. And it's usually found when you're lying down on a bed or on a bench. Even sometimes I'll have patients where it's provoked laying on an adjusting table. So when you're in the supine or side position on your back or on your side, also if you bend your neck forward or even rolling over in a bed, turning in your position on your back, that's usually what triggers it. So BPPV is a benign condition. It's usually something that can be treated bedside in an outpatient clinic with something called an Epley maneuver. And many of you are actually familiar with that. If you've had this, there are crystals that get dislodged in the ear, and they find their way to a place that just kind of wreaks havoc and triggers these type of vertigo episodes. So with the Epley maneuver, it puts you in a special type of position that can actually get those crystals in a better place and stop that from provoking the condition. And it can be very effective if that is what's causing the vertigo, if that's what's causing the dizziness. Now, that's not always the cause, but if that is the cause, that's an easy maneuver that can actually correct something like that. So that's one treatment option if that's what the cause is. Sometimes people are given medications which don't really correct the cause of the problem, just really ameliorate it. And then sometimes, adjustments can be a big help. Again, this all depends on what's causing it. And subluxation can actually cause dizziness, and it can cause vertigo. And if you ever look on those little nerve charts that are in the room, you'll see at that top level, C1 right there, If that bone is out of alignment, that can cause vertigo. And one of the reasons why is that area right up there has the blood supply, the blood vessel that brings the blood to the brain. And if that bone shifts out of alignment, very often it can kink the artery that brings the blood supply to the head. That can be a causative factor. A little below that, at C2, the second cervical has the nerve that goes to the ears. And if there's subluxation there, it can interrupt the normal flow of nerve supply and the normal function to the ear canal. And it can cause not only dizziness, but it can cause ear problems, ear infections. And so when we adjust adults, when we adjust children, we'll very often see the alleviation of these types of symptoms. In addition to that same area being adjusted with children, we will see the ear drain, especially when there is a case of ear infections. And it helps with kids getting over ear infections and preventing them from coming back. So mentioning subluxation as a cause is really important because there's many people out there who don't know about chiropractic care, and they're looking for cures and they're looking for solutions. And if they have subluxation, if that bone is shifted out of alignment, they can take all the medication in the world. They can have Epley maneuver. They can do all these different things, and really they're not addressing the cause. So I'll give you an example. One of my patients wrote this testimonial. She was referred in by a friend. She said, before starting chiropractic care, my symptoms included hypertension, which was controlled by prescribed drugs, and vertigo, which did not respond to the medication. I also suffered from arthritic pains in my back, hip, and knees, and this caused an imbalance in my walking. It caused insomnia, attacks of anxiety, and pain. I was unable to cope with some days, and I had not heard much about chiropractic care before, and I didn't feel it was important. Also, a couple of my friends, she said, went to chiropractors, and they said that they didn't improve after receiving treatment from other chiropractors. That's unusual, so I wanted to include that because sometimes that is the case. So I gave this a little thought to trying it for myself. She said, my feelings were drastically changed after going to the orientation at Dr. Yachter's office. I was totally convinced of the importance of the spine in maintaining a healthy body. During the orientation, I learned that if you find the cause of the illness via the spine and correct it, then the symptoms will eventually disappear. My health has now definitely improved since receiving chiropractic care. While my symptoms have not yet completely disappeared, my health overall has greatly improved. I'm convinced that with continued care and maintenance, I'll be enjoying a better quality of life. She said, I would certainly encourage my family and friends to become involved. 4 of my family members are now under chiropractic care, and they're all seeing a difference. So I wanted to share that with you as an encouragement and also as an informative background in terms of your working knowledge to know what you have. Every time I share one of these segments, every time you come to an orientation, every time you come to a workshop, you dive deeper into the user's manual in terms of how your body works, in terms of not just treating effects like you may have always done previously to coming to our office, but thinking about what the cause is. All right. So just remember that these are based on principles. If your body is working good, if it's healthy, and all of a sudden you have a problem, it's not because of a lack of medication. It's because there's an interference stopping your body from functioning the way it was designed and created to. And if you can find that interference, and if you can correct that interference by way of the spine and chiropractic care, then all of a sudden you may not need to take medications or go to a doctor or go to a hospital if you conservatively address this first. Find the cause and correct it, and let the body heal itself. And that's what that testimonial is about. Not that there's not a time and a place for prescription drugs or over-the-counter drugs or going to a doctor or going to a hospital. I never say that. But what I do say is find the cause of the illness first. And if you correct that, more often than not, if you give the body a chance to heal itself, it will. And that's what I want you to get out of this. And when you get that and you have the faith and the confidence to follow through with that, and you give yourself a chance to watch this work, you'll get the most out of this user manual, and you'll get the most out of the care that you're receiving now. And most importantly, you can be an encouragement to others. So whether or not you know somebody who has vertigo or a family member, friend, or any other health conditions, remember, you know something. You know more about health now than most people in this community. And with great knowledge comes great responsibility. So if you know something and you see someone, please say something and let us know how we can help. Thanks for joining me today. I love and appreciate you. God bless.